So that is all the 4 lectures for now, and we have some questions in the chat box. Before I read the questions, do you have any questions for each other, for the other speakers? 我来打开那个。Yes, hello.
Can I ask a question?
Yeah.
Yeah, so first question is to Professor Jiang. So what's the wattage and time for uterine fibroid ablation? And is it moving short, or just we have to keep the antenna into the lesion and ablate it for a longer time like in liver?
OK，蒋主任这边Dr. Ajay 对您有一个问题，就是说做子宫肌瘤消融的时候设置的功率和时间一般都会多少，在什么范围之内？然后一般是消融针插入进去之后就一直就是长时间烧，还是说要做那个移动式消融？您的麦没开。
Okay, Professor, we usually with 50 to 60 这个 watt 应该是do the ablation, then we usually enlarge fibroid. We in one procedure we do two or three minutes. Then we see the gasification. 我可能用英文讲，你翻译嘛好嘞。
对的，您讲的对的，
您讲的对的。我用英文讲吗？还是用中文讲？
都可以，您看吧。
就是我一般还是用50到60瓦的作用，然后呢，这个也是从大的概念上来讲，也是用移动消融法，但是呢，因为它这个肿瘤比较大，我一般的移动消融法呢，时间肯定会比较长。比方说我这一点作用呢，会作用2到3分钟，看到这个范围呢，基本上这个跟时间长的也是在这样一个范围。所以呢，我会2到3分钟这样可以作用到这个3公分左右了，就是2.5公分左右。然后我再这个退，比方说这个相当于2.5到3公分的范围，退了之后再第二根针作用，第二次的作用再是这个作用2到3分钟啊。那么这样如在一个这针刀上推几次，把整个长度消融掉。但是我做一个大的肿块，由于一次消融的时候可能范围很大，第二针的移动的第二针、第三针就会比较困难的时候，我们一般会设计好用2根微波针，同时布好，同时作用，使它基本上会整个的给它消融。比方说2根针作用也是作用2到3分钟，范围基本上稳定之后，我就再退。所以这样的话呢，就是双针作用的时会更多一点点。OK。
好的，谢谢先生。So, Professor, normally cover to 50 to 60 watts, and most of the cases he also prefers to do the moving ablation. But since the uterine fibroid normally they're quite big in size, so he prefers to ablate in one location to 2 to 3 minutes to achieve a 2.5 to 3 centimeter ablation range, and then he readjusts the antenna to do the second location. But when the lesion is quite big, he prefers to use double antenna at the same time to achieve a bigger ablation zone and achieve a complete ablation. Okay. Dr. Ajit, your mic is off. Your microphone is off.
Another question to Dr. Shea. Professor, can you tell me for the breast lesion, how much voltage we are using in the microwave, and at what minute, at what second means we have to move the antenna for moving short?
Dr. Su.
Okay, thank you for your question. I will use the 25 watt into ablation, maybe 5 to 10 seconds, and to move the needle.
So just like
at first, I try to do the 40 watt, but I found the patient after ablation, the nodule absorbed very slowly. So I to reduce the power, and now we will usually to use the 25 watt, and I think the absorb is very fast. So I think it is very effective by the 25 watt.
Okay, thank you.
And what are the chances of injury to the glands during the ablation? If any female in the reproductive age group and wants to lactate a child, so is there any contraindication in ablate the fibroadenoma? Is there any chance of injury to the mammary glands?
I'm sorry. This question is for which doctor?
Dr. Shu.
Dr. Su. Okay. Dr. Su, did you get the question, or should repeat it? Your mic is off, sir.
Oh, I can hear you clearly. Sorry. Which is the question?
Means if any female is doing breastfeeding to the child, and if we want to ablate, can we ablate the lesion in the breast of a breastfeeding mother?
Chairman, can you repeat the question?
Then I'm asking if we can we do the ablation in breastfeeding?
Okay. 问题是，如果是一个哺乳期的女性的话，能不能做消融？这个会不会是一个禁忌症，或者说是一个相对禁忌症？
Okay. If it is a benign tumor, we didn't do the ablation during the pregnancy. Maybe we will after the pregnancy, we will do the ablation.
Okay. 所以是哺乳期间是不建议做，然后哺乳期结束之后可以是吗？ Okay. So it is not recommended to do the ablation during the lactation period, but after the period, it is okay to do the ablation.
Thank you, sir.
Okay. So any more questions? If no question, then we have a couple of questions in the chat box, so let's check it. One question is, what are the strategies to protect the skin and the deeper pectorals from thermal injury? This question must be for Dr. Su. Dr. Su, please.
There are several ways to protect. We build a liquid isolation bed, and we can puncture the long needle below the skin and to continue inject the normal cells by the systems, and we can to apart the skin and the nodules. At this time, the ablation is set. Also, we can if the nodule is very close to the skin, we can reduce the power. Example, the 20 watt, maybe it is safe. And when we see the gas is close to the skin, and we will stop bleeding. And also we can move the needle tip. Example, it is very close to the skin. We will to press down the needle tip and to far from the skin. And at this time, we can ablation the nodule close to the skin very safely. The same to the tip pressure. Sometimes we can move the tip just like plug up the needle tip and to far from the tip pressure. And also the liquid isolation bed and reduce the power is the same to the skin. Thank you.
Okay. Thank you, Dr. Chu. Thank you. We have another question for Dr. Anubhav.
Yes.
Okay, if the results are identical for radiofrequency ablation and microwave ablation, how to select? Are the complication rates different?
So if we look at the published literature, then it's primarily based on the comfort level of the performing interventional radiologist. Whatever he's comfortable with, he can use any of that. And the complication rate, if we match the data, then it's not. But we also understand that there are less number of nodules or the adenomas which have been subjected to RFA radio frequency. So a lesser number is just we just seeing lesser number of complications because there are lesser number of nodules which have been subjected to it. So we have to have a larger data to actually have a comparative answer to that.
Thank you.
But at the same time, we also understand that it's a lower energy ablation than microwave. Microwave is sudden large energy which we get. So hopefully it'll have less complications.
Okay. Thank you. I know that Dr. Jiang, Professor Jiang, you're also experienced in thyroid ablation. So what is your opinion on this question? If the results are the same for RF ablation and microwave, how do you choose?
Okay. I speak in Chinese, and then I please translate. 对于这个射频效能跟微波在甲状盘腺当中的作用呢，事实上就是还是它的区别是有一点点，但是还是比较微妙的。就是说，如果说经验不丰富的人来说，可能会选一个这个射频，这个可能会更安全一点。为什么这么说呢？因为射频针相对呢比较锋利，你做起来见针的时候，这个比较这个容易一点。第二个呢，相对这个射频的作用范围，这个还是相对这个比较固定一点点啊。但是微波呢，就是它比较目前的微波比较钝一点点，那么跟射频比较起来，钝了一点点呢，你见针难度会增加一点。但是呢，你有经验了之后，比方说我们会一边见针，一边这个开启这个攻略作用，所以这样的话呢，也是这个容易见针的。那么关于呢消融的范围呢，你如果说这个持续的作用，可能微波的范围会热辐射会大一点点， 但你控制好了有经验了之后，你看到它的气化增强的范围，那么以及它相对来讲呢，作用的功率会高一点点，效率会高一点点。所以呢，你在停留的时间啊，根据增强范围控制好的话呢，也是可以能够精准的控制的啊。主要是这个对诊断盘线来讲呢，操作的技术还是比较重要的啊。Thank you.
Okay, thank you very much, Professor Jiang. The question, Professor Jiang mentioned that like himself, he would recommend the doctors who has less experience in the thyroid ablation to use RF ablation because the puncturing would be much easier and the energy control would be more precise. But if the doctor has already some experience in the ablation, thyroid ablation or parathyroid ablation field, and they feel comfortable with using microwave, they can choose microwave ablation as it is much faster and can create a bigger ablation zone. But if the doctor is comfortable with the ablation energy of microwave ablation, they can detect the vaporization area during the operation to control the precise ablation range. So it depends on if the doctor is experienced enough to use microwave or if they are comfortable with RF. So that is what Professor Jiang recommends. Thank you. We have one more question. What size of tumor can be ablated in breast ablation? Dr. Su, could you please answer this question? 您的麦没打开。
Okay, many patients are very interested in this question. Whether the nodule after ablation we didn't resect them will it is dangerous. Whether the nodule will affect their body, but the answer is no, because the nodule is destroyed. The nodule is dead. It cannot creating. After ablation, the nodule will be absorbed. Maybe in 3 to 9 months after ablation. The nodule it cannot affect our body and it is safe.
Okay.
That's my
Okay, thank you. Okay. There's another question for Dr. Ajit. Would you do track ablation when you're doing thyroid ablation with microwave? Your mic is off, sir. Microphone is off. Hello, Dr. Ajit, your microphone is off. Your microphone is off. It's on the right side, right lower right. Okay, good.
Can you hear me now?
Yes, perfect.
So tract ablation is not needed in the thyroid ablation because whenever we are doing with the moving shot technique, so in the last when we just remove the antenna, we ablate it up to the nodule periphery. So the periphery of the nodule, if there is some part of the thyroid parenchyma is there, we can ablate up to the surface of the thyroid, but we should not do the ablation into up to the skin level. So usually the tract ablation is not needed in the thyroid ablation.
Okay, thank you. Thank you. Has the ablation data for parathyroid adenoma matured adequately to structure a trial via surgery? This question is for Dr. Annabelle.
Could you just repeat the last sentence.
Okay, has the ablation data for parathyroid adenoma matured adequately to structure a trial vs radiofrequency ablation vs surgery?
So there was this retrospective study which was published in 2019 where microwave ablation data was compared with surgical resection, and I think it was on 108 patients, and the propensity scores were matched. And this study was done in China only, and what they said was that the curative rates were comparable to surgical resection and the microwave ablation results. However, because the propensity match scores were used and there was no, a prospective study. So I think for microwave ablation, we still have lesser studies on longer follow-ups. So we need to have longer follow-ups for these patients. Because for surgical resection, we have follow-ups almost up to 10 years. So we need to have longer follow-ups. The maximum follow-up that we have for microwave ablation is 48 months. So we need to have longer follow-ups to have head-to-head comparison with surgical data.
Okay, thank you. Okay, thank you. So one more question for Professor Jiang about uterine fibroid ablation. Except for hydrodissection, is there any other way to protect the endometrium? This is one question. Another is, how long after the ablation can a lady, get pregnant again?
Sorry， 就是你再用中文说一下看，这个他的问题。
好的，就是那个，首先第一个问题就是说，针对子宫内膜的保护，除了水隔离之外，还有其他什么方式？然后第二个问题第二个问题是消融之后多长时间可以再次怀孕
？OK， 这个保护内膜的方法呢，就是我们可以通过这个宫腔注水的方法。那么宫腔注水呢，实际上是通过超声这个输卵造影的这个放在宫腔里面一个球囊，把它堵住，使它水不回流。那么接着打水，那么水可能留在宫腔里面，不一定流得老，不是很多。它可能会到输尿管，通过输卵管到腹腔里面，但是它有这一点点水就可以很好的保护，因为这个球囊也可以分开这个宫腔，再加上有一点点水可以保护，这是第一个打水的保护。第二种呢，就是说我们可以通过移动消融的方法，也是在靠近内膜的话，靠近宫腔的话，那你可以作用的时间短一点就退作用，那么这是一个移动法。第三个呢，就是通过监测这个增强的范围啊，这个离开内膜一点点，不要一定要达到内膜。那么这个是这个第四个就是说，我们还是在这个内膜边上的时候，不要作用时间很长。因为很长的话，事实上热会辐射到这个宫腔里面，它不一定增强，但是它会慢慢的热辐射对内膜也会损伤，所以我想主要还是这几种方法吧。
好的。那第二个问题的话，就是消融之后多长时间可以怀孕？
一般呢，就是有两种情况，就是这个肿瘤相对超过5公分以上的话，我们还是这个消融的时候，如果他要这个短期内这个怀孕，有的时候我们会这个针会经过内膜，经过内膜呢，虽然我们说要保护，但在这个时候呢，经过内膜实际上呢也是该 消融以后的肿块一个出路。那么它的坏死物可以通过这个内膜可能流得比较快，这样呢，它这个缩小甚至完全消失的可能性都有，这样时间会快一点点。但是如果这个你一般的消融，它有的时候这个缩小会比较慢，那么我们一般会让肿瘤缩小到5公分左右，或者5公分以内啊。那么这样的话呢，怀孕以后就不太会影响，因为一个肿瘤大的话，还是会影响到它的怀孕的程度。所以呢，我们消融以后，有的时候呢，会根据它的缩小的范围啊，一般来说会在3个月以后，但是如果肿块缩小很慢很慢，可能会要6个月啊。所以我们还是根据肿瘤的这个缩小到5公分左右或者以内的时候，我们再建议她怀孕。
好的，谢谢。So for the question how to protect the endometrium, Professor Jiang told that injecting like saline water into the cervix could be a good way to prevent the endometrium injury with a water-filled balloon to inside the cervix to prevent the endometrium from the thermal injury. And the other way is to do the moving shot ablation technique, so that when the ablation is near to the endometrium, you can try to avoid endometrium from hurting. And the other way is to real-time monitoring by the ultrasound. And when you see the echogenicity getting closer to the endometrium, just try to avoid it, try to keep a little distance. And the other way is when ablating near the endometrium, try not to ablate for a long time, because the heat may affect the endometrium, even though the ablation antenna is not that much close. So these are the ways to protect the endometrium. And for the patients, after how long time the patient can get pregnant after ablation, for this question, Professor Jiang mentions that actually it depends. In many cases, it depends on the lesion reduction rate, because if the lesion reduces to less than 5 centimeters, it is okay to get pregnant, like in 6 months. But when the lesion is bigger than 5 centimeters, we should monitor. We should do the follow-up to see if it is safe, to evaluate and give a more specific guidance to the patient to be pregnant again. So some cases it is after 6 months, but it really depends on the lesion reduction rate. Thank you, Professor. And we also have another question regarding breast ablation. So Dr. Su mentioned that he normally uses 25 watts to 30 watts to ablate the breast nodules. So the audience are confused. Is it for just for doing the track ablation, or this power is enough to do the microwave ablation for the whole lesion? Dr. Su, please.
In my opinion, I think the 25 watt is enough because we will to do the contrast enhance, also to do the MRA after ablation, and we will to follow up our cases, also indicate that the watt is enough.
Okay. Thank you. Thank you. Yeah, because we often get the question that is 25 watts delivers enough energy to create a tissue necrosis. So maybe that is what is confusing for some of our audience. Thank you, Dr. Su. Thank you. And we have one more question for thyroid ablation. Thyroid, how much reduction of size in 6 months, and how long it will take for 90% reduction? Dr. Ajit, please.
Yeah, so the literature says, and what's our experience says, there is a reduction of at least 50% in size at the 6 month, and 90% reduction is seen at the 1 year follow-up.
Okay, thank you. Is it like, is it same in all the cases where?
For this, it's for the solid nodules. For the cystic, it is greater than that, because in the cystic nodules, whenever we aspirate the cyst, the size will decrease to approximately 80% decrease size at the time of operation only, and then that there will be decrease in the size and no refilling of the cyst at the 3 months. So the size reduction is approximately 90 to 95% at 3 months for the cystic lesion. For the complex, it may be the 90% at 6 months. But for the solid nodules, it's usually criteria is 50% at the 6 month and 90% at the 1 year follow-up.
Okay, that's great. Thank you very much. Okay, we have another question for fibroid ablation. For fibroid, what are the usual way of access to the lesion, percutaneous or transvaginal? Professor Jiang. 您的麦没有打开。
我刚才没注意听这个题目，你再重复一遍。
Okay. For 就是子宫肌瘤，针对子宫肌瘤的话，平时就是一般的那个竞争方式，就是说，是经皮多一点，还是说经阴，还是说有其他的方式
Okay. Most of the patient or most of the myomas, we use the transabdominal approach. With sometimes in some patients we may use the transvaginal.
Okay. So is there any difference between, like, for what kind of lesion you prefer transabdominal, and for what kind of lesions you prefer the other way? 您的麦没有打开。现在好了。
因为肿块都比较大，这个我们在这个肩腹能够做的，那么我们都会用肩腹引导下的穿刺。但对一些病灶比较特别的、比较小的，那么我们会经阴道穿刺。但经阴道穿刺呢，有的时候就是这个还会通过一些结构那么避不开一些膀胱或者是结构的话，我们可能还是会用这个注射治疗，比方说用无水酒精，现在更多的是用聚硅醇来治疗，因为对那些小的病灶，特别内膜下的，那么可以经阴道，否则一般的大部分情况都是经腹壁的经腹壁经眼消融。
好的。Okay, for the lesions which are bigger or like large in size, Professor Zhang prefers to do percutaneous ablation because it is much easier for him to operate. And for the lesions which is smaller or in a very special locations, they might prefer to do the transvaginal approach. But for the smaller and in a very special area, sometimes they also prefer doing the chemical ablation, injecting the chemical drugs to do the ablation because it is very small, and sometimes when doing the transvaginal approach, it's difficult to avoid the other structures So they do chemical ablation. Thank you, Professor Jiang. And the questions are pretty much all that we discussed. So do you have any questions for each other? No? Okay.
No question, Dr. Dana. I would like to invite Dr. Arun Gupta, our secretary of ISVIR. So Dr. Arun will come. From ISVIR side, Dr. Arun is here.
Hi, Dr. Arun. Thank you for joining us.
Thank you. I was always there. So thank you, Dr. Jiang, Dr. Su. It was really very informative talk from both of you, and personally, I myself has learned a lot, and possibly we will start doing the ablation for fibroids and breast also. We have done just one ablation for uterine fibroid till now in our institute. And I would first like to thank CCMA. This is our joint meeting after a very long time. And also I would like to thank Eco Microwave for sponsoring this and made this event very successful. Thank you.
Thank you, Dr. Arun. Thank you. We also want to thank ISVIR for supporting us and co-hosting this webinar. Thank you very much. So it seems like we are coming to the end of the webinar. We would like to thank all the speakers for the wonderful lectures and the discussions. It's been very informative, and I believe our audience they will be benefiting from all the informative lectures. So CCMA and ISVIR joint webinar is now over. Thank you for watching, and thank you for participating. Thank you very much. Thank you. 咱们人在线，苏主任也在线。在的。
蒋主任、苏主任今天辛苦了，今天的直播到此就全部结束了。
麦没有打开。
谢谢，我会有机会也是学习这个英语口语差一点，但是多练练还是好的啊。
主任，您今天整个课程是非常完整的，你也说您的好多方面都是非常清晰的。对。
好的，谢谢啊，有这样一个机会也是这个不错的啊。好，谢谢。
谢谢主任，辛苦了。
好，再见，来。
好，再见。